Well, hello, and welcome to an MRASH panel discussion. And we are going to be talking to you today about striving to conduct effective agricultural safety and health outreach during a pandemic. And we subtitled it, the panel, From John Deere Masks to Plexiglass. Just to give everybody the idea about the wide range of barriers and challenges and out-of-the-box thinking that we had to do to continue the valuable outreach to our agricultural communities. And today we're going to, our panelists include Megan Shoshow, Marcia Cheney, and myself, Ellen Duysen. And we'll start with just a few introductions.
Hello, everybody. I am Megan Chasso, and I am on the outreach team here at the Upper Midwest Agricultural Safety and Health Center. We represent a 5-state region in the Upper Midwest and focus on improving the health and safety of farmers and their families.
And you're muted, Marcia.
Hi, I'm Marcia Cheney. I'm from the Great Plains Center for Agricultural Health, located at the University of Iowa College of Public Health. I've served here as the Evaluation and Outreach Coordinator for about the last 8 years.
Thank you, Marcia. And my name's Ellen Duysen, and I'm the Coordinator and Outreach Specialist for the Central State Center for Agricultural Safety and Health. And we are located at the University of Nebraska Medical Center in beautiful Omaha, Nebraska. And we are going to spend just a little time today sharing some of the successes and the challenges that each of us have had with the our outreach since the pandemic. You know, outreach is never easy, right? We're traveling, and you're trying to be innovative and interesting while you're delivering important messages. But this year has presented some special challenges, and those we'll be discussing and how we overcame those challenges. So we started off with a quote: "The only thing that ever sat its way to success was a hen." And we're going to talk a little bit about how hard this work is. You know, the moving through this pandemic. Trying to navigate all the things that were put in front of us. And it has been hard. And I think you'll see the work that went into getting some of this outreach. And we want to also spend some time talking about not just our successes, but some of the challenges. So with that, we will start with Megan.
So UMash has outreach activities happening really heavily in the summer months, but many of our activities are kind of happening year round. And so one of those include everything that we do to respond to emerging issues. So this year we decided to focus those efforts on how do we support agricultural workers as they age. You know, many of us know that the average age of the farmer is, quickly rising towards 60 and beyond. So what we had planned to do was to connect with stakeholders and be physically on the farm, have space for conversation, questions, and partnership building in regional communities throughout the Upper Midwest. The pandemic had other plans for us, and so we decided that we needed to change the approach, but we still wanted to be starting these questions. So how as a community do we support the health and safety of aging farmers and their families? And so we decided to just pivot this work and make it go online. And while we were doing these activities, we knew it was important to be engaging some of the folks that are really important in our agricultural communities. So we engaged universities in Minnesota, South Dakota, North Dakota, and Wisconsin. We really made sure that we were going to keep farmer voices in the panel, because that's something that's important to UMash, and the representation in any of this work is critical. But something that we knew was going to be challenging was recruiting people to come to a Zoom community forum. And so we did that through a number of ways, one of those being through a video. So we I would encourage folks to check this link out when you have 2 minutes, but it just frames, why we're working on supporting aging farmers and what some of that was going to look like. We also decided to host a wiki survey. And if you're not familiar with those, it allows you to, choose between different things. And eventually you get what is basically a rank choice of what preferences were. And so in our situation, it was, what are the most pressing issues to folks as they age on the farm? And that really helped, spark people's interest and join our event. And so the recruiting was really key here so that we could get the right folks in the room. And we wanted to have those that were in public health and aging coalitions, ag organizations, academia, research, and things like that. And we facilitated that by offering CEUs for those folks attending. So this gives you a snapshot of what it did look like. While we envisioned ourselves being on the farm, we were still together in breakout rooms on Zoom. So we started by setting up the issue. We had a Q&A and a panel discussion, and then we went into breakout rooms. And in those breakout rooms is really where we were able to fill in some of those gaps that were happening in outreach during the pandemic. So when you're not able to physically be together, some of the activities that are hard are doing the things like networking and building partnerships and building coalitions for activities that you're working on. So in those breakout rooms, through the facilitation of, UMashers, students, things, folks like that, that's where we were able to get ideas started and shared, resources shared. And ultimately, that's where some of the ideas came from that we ended up able to fund through our partnership grant program. So as we mentioned, having the voices of the community in the room was really important to UMash. And so we've now partnered with 4 different groups to innovate in this area and support new work to support healthy and safe aging on the farm, even in the pandemic times. So normally in the summer, UMash is out romping around the upper Midwest, often hand in hand with the folks on this presentation today. So you would oftentimes see all 3 of us boots on the ground at something like Minnesota Farm Fest. But this year, we knew that that was going to look kind of different. So in 2019, UMash hosted the Wellness Pavilion at Minnesota Farm Fest. And at this event, folks were able to access free exhibit booths, free live demos, and free health screenings. And pretty early on in the COVID-19 pandemic, we decided that there was not a responsible way that we could do this. And that's when we had the conversation that we were going to host the 2020 UMash Online Expo. And so once again, we had 3 main areas. We had live safety demos, we had health and safety talks, and we had virtual exhibit booths. I'm just going to talk really high level about all 3 of those. So when it came to our safety demos, it was really important to think about what topics we wanted to focus on. We know these are a great way for folks to learn, especially some of the young adults and kids. And so we focused on grain incidents, things with machinery, and then also looked at ATV and UTV safety. In addition to the topics, it was really important to have great partners because we needed people that were comfortable coming alongside us doing something that was new. So we were doing a blend of pre-produced videos with things that really were happening live. And this all took place over Zoom. The second live happening was our health and safety talks. And it was really important for us for these to be informal and short, almost like a TED Talk, rather than, an academic presentation. So in addition to keeping them informal and short, the themes and the topics really needed to matter to the folks that we wanted to be connecting with. And these also took place live over Zoom. And were also broadcast to Facebook and our website live. And then finally, for our virtual exhibit booths, we included a pretty diversity of categories. So everything from ag centers to resources for children, research opportunities, Spanish resources, things of that nature. So this gives you a little bit of a taste of what things looked like. So in the blue farm workers box, you see what one of the safety talks looked like. And the bottom with the four-wheeler, that's what one of our live safety demos looked like. So people were able to hop on their noon hour and engage with the folks that had both pre-produced videos ahead of time that we could play and discuss, and then also hear live from some of the experts in the field like we would normally have. And then finally, we get to see what one example of a booth looks like. So some of the resources and things of that nature. And with this event, we wanted to keep in mind that we wanted to reduce as few barriers to participate as possible. So we did not require people to register. And then when it came to partners, we wanted to make sure that we had as much in place ahead of time so that they felt comfortable coming alongside us while we re-envisioned what outreach looked like. And then finally, UMash was deeply involved in creating brand new COVID-19 resources once the pandemic really picked up. But we also wanted to think about how we give extra mileage to things that we already have created. And so one of our key resources is the farm safety checklist. And so one of our strategies was to essentially sneak in COVID-19 recommendations to help keep folks safe during the pandemic if they were leveraging these resources already. So we went in and updated some of the most critical resources that oftentimes involved working with other people. Another resource that we already had, in our wheelhouse that we've been mailing out to people, we'll see it on agri-tours and venues, is having things like hand washing posters. And so normally these would have recommendations for folks that are visiting an agritourism event or, visiting a dairy farm. And so we updated these so that folks knew, what were the workplace recommendations so that they felt like they knew some of the recommendations for going to work and going home healthy. And then finally, I think we all recognize how strained educators have been this year with either being in person or being online or being a mix of both. And so putting together 10 ways that folks can drop ag health and safety into their classroom with it being as light of a burden as possible. And in lieu of handing out a lot of these materials in person like we're used to, we got comfortable snail mailing and emailing and jumping into online presentations, and then also doing things like talking with media so that, folks were still having these conversations with us, even though we couldn't do that on the farm. And now at this point, we're going to hear about what our friends at Iowa have been up to from Marsha.
Thank you. So the Great Plains Center serves Iowa and the surrounding 8 states, and that's a large area to serve in-person outreach effectively. And so fortunately, we'd already built an infrastructure of online and in-print outreach. So when the pandemic hit, we were able to continue much of that previous presence online and in print. Our Facebook and Twitter feeds took on a different focus some of the time, but we were still able to maintain our seasonal campaigns like roadway safety during the planting season and national campaigns like Mental Health Awareness Month. We also continued to write our monthly Safety Watch column for the Lee Agri-Media publications. So people were able to read those in the Iowa Farmer Today, Illinois Farmer Today, Missouri Farmer Today, and Midwest Marketer. But other activities, we're going to need a great deal of transformation. And one of those was our annual summer session of the Agricultural Safety and Health Core Course. And so we needed to transform what was normally a 40-hour in-person class that included lots of hands-on activities and small group exercises and field trips into an online format that could still deliver that same great training and allow us to continue offering continuing education credits for all of those professionals out there searching. We ended up with a much smaller class this year, but a very diverse group of students from across the nation, from Alaska to Georgia and everywhere in between. And it included healthcare providers, producers, students, government workers, and some new staff from other ag centers. We kept the week-long format and divided it into 2 parts each day. So there were synchronous live streamed activities each morning from 8 a.m. to about 12:30. We started each day on Zoom with a discussion of the previous night's homework, followed by live streamed lectures, and used breakout rooms to keep the case studies that have been so popular. We also used games like Jeopardy and Kahoot to keep the sessions more interactive and entertaining. And then in the afternoons and evenings, students were able to complete asynchronous work, whatever time worked out well for them. And that asynchronous work included videos, recorded lectures, interactive online modules that we've been developing, some virtual farm tours, and podcasts. And so another thing that we ended up doing a lot of was capacity building. So we'd previously used infographics in our outreach materials, and we'd created some videos, but this hadn't been our real focus for outreach. So over the course of the spring and summer, we increased our expertise with Zoom as an outreach format and to record interview style videos. We also learned new formats, platforms, and programs for recording and editing other types of video, as well as creating animated episodes. And we were involved with the CDC as they were developing their guidelines for agricultural workers. And then after those came out, we spent those early months of the quarantine translating the guidelines, which was a very heavy text document, into short videos that could share that information effectively. And many of those early videos were related to face coverings. So why and when you should wear your cloth face covering, health concerns regarding face coverings, fit and features of different styles of cloth face coverings, and how to don and doff them safely. And here's a short clip as kind of an example of what these videos were like.
When should farmers wear a face covering? That's a great question, because a lot of farmers think, well, I don't need to wear one. And most of the time, they may be right. They don't need to wear a covering when they're working alone. So if they're out in the fields by themselves, if they are driving a tractor and nobody else is in the cab, these situations, they're not infecting anybody else. There's nobody around them. So you don't need to wear a face covering if you don't have other people around you. Another rule of thumb is if you are working and living on the farm and your family is sharing the same household with you, you don't need to go ahead and wear a mask unless you have symptoms and other reasons, but you don't need to put a face covering on to protect those in your family because you're already sharing the same germ pool. It's when other people come to your farm or when you have employees that are working on the operations with you and are, within 6 feet or 10 feet or 12 feet, you really want to make sure that you are not infecting them and that they're not infecting you. So people that are outside of your household really should be asked to wear a face covering, and you should also be putting a face covering on so you're not getting them ill. If you have a really small farm and don't have a lot of people coming onto it, think about your delivery people. You want to make sure that they're protected and that they're protecting you. So keep a distance with those folks. If you've got a contractor that's coming out to your site, keep a distance from them and put on a mask if you need to give a hand and work closely with somebody.
And so continuing with our theme of capacity, or outreach capacity building, we're working on creating a podcast next. We heard from our students in the core course that the podcasts that were part of the asynchronous work were really a good format for them, because after they'd been on Zoom all morning, this allowed them to listen to their course materials and keep doing their work without having to sit in front of a computer screen. And so also during regular contact with our regional advisors, we were hearing from them that they also wanted podcasts, or the people that they were serving needed that type of resource as well. So we're currently in the research and planning stage for our new podcast. It doesn't have a name yet, but we're starting to get a good picture of what we want this format to look like. Approximately 20-minute episodes that will start with true stories that have happened on the farm, and then talk about the science and the research around that topic, and end with prevention strategies for people to use as they work and live on the farm. And so next, I think Ellen's going to talk to us about what's been happening in the Central States.
Yes, thank you. Thank you. both for great information. And I've learned a lot already. So I want to share what we have been doing at CS Cash since March to move forward our research, continue the research that outreach that we have done over the years. And I think you'll see that it builds upon what Megan and Marcia have shared. And we're all missing each other, not being able to work together. And so some of this you'll see dovetails between the centers as well. So you heard Marcia talk about their Ag Med course. Well, we hold a similar course in Nebraska, and this happened to be our 10th anniversary year. So we had big plans for this year, lots of events and fun things that were going to happen live and in person that obviously could not happen. So when we were thinking about how we would reformat this to best work for our healthcare providers and our students and those that would join the course each year, we really started thinking about there again, getting more people involved than we had in the past. And so our goal was to really lure folks to this week-long course. And that's a huge task, right? That's a huge ask of folks. So we normally have 3 different sessions that people can sign up for, and we maintain those 3 sessions. And we decided early on that we would not charge for the course this year. And that was as part of our celebration and a thank you to essential workers, many of whom had been working long and hard and had not been able to get the CEUs completed that they needed for their certification. So we offered this free of charge, and let me tell you, when you offer it free, they will come. lots of interest simply because of that factor. We always think we have great content, but this year we really needed to step it up a bit. And our presenters did that. They reworked a lot of their presentations, and the content really was exceptional. We offered continuing education credits. That's a huge draw. So getting back to our goal of luring, we incorporated some different aspects during the breaks, and one of them was yoga breaks. Linda Emanuel from AgriSafe was generous enough to come on and do our yoga for us. We also felt like to have folks really feel more part of the course, we offer them normally a huge packet of materials when they come in person. So we mailed those resources. And I will tell you, if you are considering doing that, do budget that in because it is expensive. But for us, we were not having to feed folks. We didn't bus them we had a virtual farm tour. So we had some savings that we could put forward toward those mailing resources. So not only information, but other things that our presenters had us put in these packets, as well as some PPE for Carolyn Sheridan's fit testing that she did on our Friday session. And then we promoted, and I want to thank our partners here and other partners that may be listening for helping us to promote this throughout our networks and your networks and to our stakeholders. Our success is our last box, 190 registrants, which is significantly higher than we have ever had for this course. 158 joined session A and B, which were our live sessions, and then we had 136 that stayed on for session C. We awarded over 3,000 CEU credits, and we had 143 unique learners that claimed those credits, as well as some academic students as well. So we have some pictures here. I included the top left picture. If you look real close, you'll see Kelly Dunham. And he's kind of the cornerstone. He started this course back in Iowa and many years ago, in the 90s, I think. And he is still the cornerstone of our course as well. So we thank Kelly for his many hours of work for this course. We have Linda Emanuel showing you one of her yoga poses that I quite frankly could not if I had done that, I couldn't have gotten up, but I do appreciate her enthusiasm and getting us to do that. And then, of course, Carolyn Sheridan did a great job virtually and really engaged people with her PPE and fit testing. And then I want to talk about our tractor safety training. Now here we move into a hybrid event, and this is really a challenge. So this became a lesson in effective communication and planning, because our goal was to ensure the safety and health of all the students that needed to come together to do the driving portion of this certification. We were able to do the classroom and exam part virtually, thanks to Penn State. And their online course. We could direct these students free of charge to that course. We are very grateful for that. But the driving certification is required to get your husbandry permit. And so we had to do that live. And I'm going to real quickly talk about how we managed and what we did, the protocols that we set to make this a safe event. So we did have mask and distancing mandates in place that were part of an established protocol. And I want to talk about that and really emphasize anyone that is considering doing a hybrid event in these times, you have to have an established protocol, and you have to have buy-in from everyone. And we started that template with our UNMC requirements for meeting at that particular time. They've changed and morphed over time, but this was back in May. And so we had UNMC, our University of Nebraska Lincoln, who are our partners in extension through this training. We had our trainers weigh in on what their protocols and what they wanted to see as part of a protocol. And then of course the facilities, which were all this year they were all extension. No, that isn't true. We had a tractor dealership that also weighed in. One of our trainings was held at a tractor dealership. We wanted everyone to be on board with what was going to happen, what was going to be required. And so our students and parents were communicated with extensively. Many emails were sent out, and they actually had to communicate back that they understood the protocols. We had mask and distancing mandates. We had a student that made us branded masks, absolutely adorable. John Deere, International Harvester, Huskers, anything that we thought these students might think was a little less obtrusive. We are talking about a group that a lot of these students have not seen their parents wearing masks. They're rural communities that a lot of them had not bought into the mask wearing yet. So we had to bring that to them. We also provided the education on COVID. We established cohorts, which is another thing that is extremely important if you're going to do virtual, or in-person training. So we only brought 2 to 3 students on every 2 hours. And let me tell you, we had 25 students in North Platte. So you can do the math. We were there a long time to get all this training done. And we asked them that if they had people that they played sports with, they went to school with, if they had them within the same family, we asked them to come together as a cohort. And then we knew that we were a little less likely to be transmitting something between our students. We had disinfecting protocols. The minute they stepped out of their truck, they got a mask, they got a bottle of hand sanitizer, and our trainers had ethanol that was sprayed on everything between each student. So it was a burden on everyone, but a burden that had to be a task that had to be completed. We did 5 trainings in 5 days across Nebraska. It was a marathon week. We had 61 students that received certification. They completed their exams and their online training, brought that certificate to us, did their driving, learned about PPE. We had, and ATVs, we had incorporated some more information while they were waiting to drive. And then we only had one issue with our mandates. If you're interested in what happened, how we solved that without going viral, please give me a call, because it was important that we handled that with care and sensitivity. And I felt like we really did. The evaluations were good from the students and the parents. We asked them to evaluate as well this year, which we normally don't do. Here's some pictures. You can see our up in the upper left-hand corner there. We've got our trainers, and then we have 4 students there with their their masks on. You can see in the lower corner, we wanted these students to feel like they knew us, but would not come too close. So we would have these circles as each group came in every 2 hours. We would circle up. You were allowed to drop your mask and tell us about yourselves. And we felt like that really helped us connect with them. You can see the young man up top. He chose a Husker mask, and then he put his sun hat that was part of the PPE pack we give them. He put his sun hat under his Huskers hat. We love that picture, and I think it speaks volumes about the buy-in that we got. And then the two young brothers that were listening very attentively to the trainer there. And then in the bottom, you can see Risto, our director, Risto Ratiana, and he did the training for us in Weeping Water and did a great job with keeping everybody safe, and ended up the day with students that were very happy to have completed the course. And then I will finish up with talking about another hybrid event. This one was done with adults. It was a round table, a bison worker safety topic. That it was our second annual. We were requested by the Intertribal Buffalo Council to hold both virtual and in person in Rapid City, so that some of the herd managers, local herd managers, could come and ITBC could be involved directly. So it was a challenge. It was a challenge, but our ultimate goal was to ensure the health and safety of these roundtable attendees as they got the information that they needed to stay safe. So once again, we had an established written protocol. I'll be happy to share it. It's for meetings. We started the template or the skeleton with the CDC recommendations. We added UNMC's requirements that looked a lot like CDC's. Then we asked Intertribal Buffalo Council to weigh in. We wanted their buy-in. We wanted their understanding of what we were going to ask, but what else do we need to add? And they actually had some really great recommendations. And then the Holiday Inn, which was our venue, also had some recommendations. And most of those were actually around food service. So they added some nice pieces as well. These were all additive. We took nothing away from any protocol. Each one was just added upon the other. It ended up being a 4-page document, but I think it was fairly well set out and articulated so people understood what was expected. We communicated and asked that each of the people who were going to join in person had read that. Everyone was required to be masked if within 6 feet. And everyone had on their desk as they entered hand disinfectant. They had their mask as they came into the building and as they registered. And then all the materials had been set out the night before, and all food service was delivered directly to them at their desks. The Zoom participants, once again, we mailed packets. We made sure they felt like they had some buy-in here. And so they were having the same packets in their hands as our in-person people. And we did hear that the Zoom people were appreciative of the folks in the room, and the fact that we kind of zoomed in, used a camera to zoom in on their faces when they were asking questions. And I think it made it more interactive. And then we also provided time for people to interact. So this was a 1-day, 8-hour event in Rapid City, South Dakota. We had 78 total participants, 24 actually in South Dakota in our room. And we had 0 issues with mandates. These were adults, these were people that understood, and we had communicated clearly what our expectations for this meeting were. The evaluations were fine. No one complained about having all this onerous piece for inline or in person, and the folks that were on Zoom were really appreciative also of some of the interactive pieces that we tried to do. And this is just a picture of some of the materials that we put out on the desks. And the Intertribal Buffalo Council brought buffalo jerky. So that was a favorite. And everyone went home with quite a bit of jerky. And this is Mike Faith. He is one of the tribal leaders who started the Intertribal Buffalo Council. We did not know he was coming. It was a huge honor to have him there. And he was very grateful of all the measures that we had taken to keep his folks safe. And we're going to talk real briefly about the challenges. We've told you about some of our wonderful successes. You always start that way, right? But there were challenges, and there were some big barriers to doing this, not just time and expense. but some others. And we put a quote from Winston Churchill here: success is the ability to go from failure to failure without losing your enthusiasm. And I hope that if you take nothing else away from this roundtable, you can see how enthusiastic each of us are about the work that we do with agricultural communities, and how we have loved working hard to get this outreach to continue and just didn't want to stop because of this pandemic. So I will start by talking about the health concerns. I think we've covered that fairly well. I lost a lot of sleep over it. I worried about our people. I worried when we went to do these tractor safety trainings if the students would be cooperative. They were, with one exception. But for the most part, it was phenomenal, and people understood that we cared about them when we took these precautions. And then, of course, the compliance with protocols is essential. If you do not communicate a protocol beforehand, I think it's a disservice to the folks, to yourself, and also to the folks that you're conducting outreach with. And then I'm going to let Megan talk about some burnout.
And in today's ultimate irony, you know, Zoom burnout is very much a real challenge that I think we all had to confront in our outreach opportunities that we, you know, looked at doing virtually this summer. And it's something we certainly considered every time that we pivoted from doing something in person to doing something over Zoom, is knowing that a lot of folks don't need another Zoom meeting on their calendar, but knowing that's one of the few ways that we could have access to groups of people at this time. And really closely tied to that is internet access issues. We've been talking about broadband in rural communities for years and years, but we still know that folks really struggle with getting good access. When I'm on the farm, I'm on a hotspot from my phone, so I'm really dependent on that. And I know that folks don't always have the internet power that they need to join something like a Zoom or Microsoft Teams or whatever it is that you're using. Even folks that are, you know, in cities or more populated areas have been struggling with internet access while everybody's working and going to school and streaming and doing all their activities from home at the same time. And then finally, we've seen how challenging it can be to understand the protocols and mandates that are coming out. There are a lot of sources of information, and even just understanding the CDC recommendations are a very technical and complex, you know, area where there is a lot at stake. So knowing how to effectively communicate what is all entailed in those has really been a challenge that we've all had to rise to in the public health space. But with that all being said, we are eager and we're looking forward to talking with folks more about any questions or comments or discussion items that you might have about doing outreach during these COVID-19 pandemic times. So here you can find a way to get in touch with any of the three of us. I think we would all love nothing more than to have a conversation about this. And we are going to be available for some of that conversation on Tuesday, November 17th at 12 noon Central Time.
Can't wait to see everybody.